What about now? Because it says three participants. Three participants. Good afternoon, everyone. The webinar will be starting shortly. Thank you for your patience. Good afternoon. Just having a bit of technical issues. We should be getting started shortly. Again, thank you for your patience. Good afternoon. Um, Welcome to the Department of Family and Support Services, Children's Services, Doula Specialized Services, RFP. Joining me today will be Angel Jones Dotson, the Manager of Family Support Programs, and Soreto Burgess Burnett, the Deputy Commissioner, to provide details regarding this RFP. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on hold, on mute. Please submit questions via the question box, and we will respond to questions at the midpoint and at the end of the presentation. Please use the question box to notify us of any technical issues. Please note this webinar is being recorded. A copy of the webinar will be placed on the DFSS YouTube channel with the link to the recording under the alerts and/or funding opportunities tab. This will take up to 5 business days. Here's the agenda. We're gonna do the welcome and introductions, the purpose, background, information about the scope and program description, selection criteria, timeline, technical assistance for applicants in e-procurement, and then we're gonna have another round of questions. If you experience any technical issues, please use the question box for that as well. Now I'll be turning it over to the program team, Angel and Soreto, who will go over the RFP and the details for the services we're looking for.
So I'm going to introduce myself. My name is Angel Jones Dotson. I am the manager here for the program admin side. And then my boss is the Deputy Commissioner, Soreto Burgess Bennett. She's on mute right now, but she'll chime in when she needs to. The purpose of this RFP is the Department of Family Support Services, DFSS, seeks to serve up to 6 entities in Chicago who provide doula service to low socioeconomic status, first-time pregnant people under the age of 25 who may have high risk factors. And here we have listed the high risk factors that they may have. Ideally, respondents should currently operate PI, preventive initiative, home visiting programs, either through DFSS or the Illinois State Board of Education, which we know as ISB. And it includes an existing doula model. Due to conflicting contract dates in the previous RFP, that's why we're releasing this doula RFP. To be considered for eligibility, the respondent must directly provide doula specialized service in accordance with ISB Early Childhood Block Grant. Subcontracting the doula services are not allowable in this service. PI home visiting and doula services must be provided directly by agency staff. Next slide. Refer to the program contents and rationale in the RFP for this information. DFSS currently funds 5 agencies who provide doula services across the target community areas in Chicago, with the goal of reducing maternity morbidity and incidence of low birth weight, striving towards the outcome of increasing healthy births. Prior statistics, now this is based off of one doula. They produced 9 healthy, non-invasive deliveries, 3 C-section deliveries. They had 10 parent satisfaction surveys. They had 10 first-time pregnant people under the age of 25 who may have had other risk factors served. Annual prenatal group sessions were held. 7 babies, 7 out of her caseload, the babies were being breastfed. 9 children transitioned to long-term PI home visiting programs. 3 referrals were given out for other services that the parent might have needed, and 12 screenings for postpartum depression took place. Our goals. The overall goal of the doula specialized services RFP is to improve essentially the birth outcomes and to promote the attachment process by providing prenatal support and educational support during the labor and delivery process. The postnatal home visits aimed at promoting strong parent-child relationships and paving the way for a smooth transition to long-term home visiting services. Doula specialized services are home visiting programs that many consider to be the front door of many parents towards entry into long-term PI visiting in order to provide the family continuum care. Doula specialized services may commence at the beginning of the 3rd trimester of pregnancy and usually continues 2 months after the child is born. So it's really like a total of 5 months. The Doula specialized service program model is not intended to be a standalone service, but instead must be integrated and provide concurrently, ideally, within the PI-funded evidence-based home visiting program that aligns with Chicago Early Learning Sales standards. The home visitor, concurrent to the doula, continues to develop relationships with the family so that the family continues to feel supported at the end of the doula service. It is recommended that home visitors and doulas schedule home visits together. The Chicago Early Learning Standards help guide the implementation of this service of the Doula Specialized Service Program. Current state and priorities for improvement. Currently, funding 6 doula programs serving families in targeted areas. The following are priorities for improvement. An individual with clinical experience is part of the doula service specialized services program, so that doulas have the support they might need to serve participants who have medically complicated pregnancies. These consultants are generally like registered nurses, midwives, other professionals who've had medical training aspects dealing with pregnancy and childbirth. They are generally contracted for about 10 hours per month. As part of the comprehensive recruitment plan, programs should have memorandums of understanding, agreements, or community partnerships in place with prenatal clinics, with programs, hospitals, etc., to ensure that pregnant people in the program's target population are referred to doula services. Target population. Priority participants are low income, first-time pregnant people under the age of 25, along with who may have other high risk factors noted below. They live in the city of Chicago and are enrolled and eligible for PI home visiting or other early childhood program services. Other risk factors that impact eligibility may include, but are not limited to, teens, women of color, specifically Latino and African American, homelessness, substance abuse, single parent, limited English speaking proficiency skills, underlying medical conditions such as hypertension, diabetes, obesity. Other proposed risk factors that may negatively impact their pregnancy and child. Eligible program participants are typically families under 400% of the federal poverty level and should include other risk factors that align with eligible criteria as determined by the program. Families must provide documentation that supports their income eligibility for the PI home visiting program, including documentation that supports their at-risk designation. Priority communities and risk factors. So on the right side of your screen, you will see the priority communities. While DFSS seeks to fund agencies across the city, for this RFP, the following target community areas will be prioritized by A, capacity to serve birth to 3-year-olds under 400% of federal poverty level. B, infant mortality rates, deaths to infants aged under 1 year. C, COVID-19 mortality rates. Program requirements. Successful respondents must meet the following requirements. The program supervisor must have a minimum of a bachelor's degree in child development, psychology, or social work, and experience working with doula programs. A master's degree in the above is preferred. Doulas must meet sales PI home visitor minimum qualifications and preferably be certified by Doula of North America, DONA. And an individual with clinical experience, such as a registered nurse, midwife, or other professionals who have some training in the medical aspect of pregnancy and childbirth. The home visitor will need to have a Gateways Family Specialist Credential Level 5 by 2024. No, home visitors will still need to have a bachelor's degree while pursuing the Gateways credential. The implemented Doula specialized services model will be integrated into a long-term PI home visiting program that use either healthy families or parents as teachers as their home visiting model curriculum offered at each cell site. Doulas are required to attend approximately 2 births every month and be available 24/7 during birth. An important factor doula specialized services programs must take into account in their hiring and scheduling practices is the fact that births happen when they happen, during normal hours and outside of normal hours. Doulas must have flexible schedules because it is critical that they be present during the labor and delivery. Programs need to ensure that there is some backup capacity so that participants can still receive doula support when their primary doula is on vacation or sick or ill or unable to attend a birth. This would generally mean having at least 2 doulas as part of a program staffing pattern. But backup can also be achieved by having a supervisor trained as a doula or by having a part-time position in addition to a full-time doula. Because births happen at different times and hours of the day, doulas must be on call and have staffing to support the doula. For smaller programs, this may be a supervisor that processes the minimum training and/or credentials. Therefore, doula specialized services programs must provide 1 FTE full-time doula caseload of 20 to 30 people over the course of a year and limit doula intervention to a 5-month period that begins at the 3rd trimester of pregnancy and continues 2 months after the birth. 1 FTE doula typically has a caseload of 9 to 12 people at any one time. The caseload should be a mixture of individuals who are pregnant and/or are postpartum. DFSS through this RFP anticipates funding 216 pregnant new moms. The budget is defined will offer a maximum cost of $4,400 per enrolled mom. Slots will be awarded based on the proposed program alignment, defining the appropriate number of doula with a 1 to 12 doula to mom ratio, projecting no more than 23 pregnant moms over the course of a year. Doulas are required to develop, organize, and facilitate monthly prenatal groups depending on above described caseloads. During the prenatal groups, topics should include, for example, introductions to baby basics, nutrition and building healthy eating habits, exercise and pregnancy, breastfeeding, labor and delivery, postpartum care for parent and baby, along with discussion of the challenges of pregnancies, childbirth, and postpartum period. Prenatal groups offer an efficient way for parents to learn about prenatal care and the birthing process while concentrating with a peer group, connecting with a peer group and continuing to build a relationship with their doula. Doulas are required to provide screening for perinatal and postpartum depression as required by an evidence-based doula certification and training organization such as DONA. Referrals to other providers will be made depending on the results of the doctor clinician. Doulas act as a resource and support for the parent as they go through the birthing process. One of the primary focuses of a doula is to develop a strong, caring, and trusting relationship with the parent that serves as a model for the new parent to use as they develop their own relationship with their child. The doula will listen to the needs and concerns of the parent and family and refer to health services, social services, and government services as needed. DFSS seeks respondents with evidence of strong past performance against desired outcome goals. Performance indicators include the doula specialized services provider is required to provide doula services as an integrated part of a long-term evidence-based PI home visiting model or other early childhood program model in order to improve outcomes of pregnant people under the age of 25 who may have other risk factors. As such, performance outcomes will be assessed in the following manner: support the development of the strong parent-child relationship that serves as the foundation for the child's health and development, and support healthy births and promote healthy growth in a child. Other performance goals and outcomes: to monitor and recognize immediate progress toward the above performance indicator. DFSS also intends to track output metrics that may include, but are not limited to, and this is based on one doula, number of healthy non-invasive babies, number of C-sections, 85% of enrolled families who have completed parent satisfactory surveys, first time pregnant people under the age of 25 who may have other risk factors, providing monthly prenatal group sessions, 25% of babies being breastfed, 40% of children transition from the doula service to the PI home visiting program service, 90% of moms screened for postpartum depression, and of course, referrals to other services. In addition to the performance indicators and output metrics listed above, DFS encourages applicants to propose additional indicators and metrics, including those that demonstrate early success and are indicative of participants' progress. Selection criteria. Strength of proposed program. The respondent clearly defines services to be provided directly or through partnership linkage agreements with other agencies that are appropriate to addressing the needs of and achieving desired outcomes for the target population. The respondent's proposed program is supported by a strong national or local evidence-based and or aligns with best practices for the relevant field. The respondent has an effective approach to identifying and retaining program participants, including rules, regulations that reduce barriers to participation. The respondent has partnerships or coordinates with other agencies to extend or improve services in a client-centered, comprehensive way. Respondents clearly defines an effective system to identify and enroll first-time moms into their doula program. The respondent demonstrates the ability to successfully transition families out of a doula care into other supportive services. The respondent demonstrates a clear understanding of the target population, including their strengths and assets and needs and challenges. The respondent demonstrates client and community feedback informs service delivery. The respondent has expertise working with the target population and has relevant capabilities and/or infrastructure needed to serve this group. The respondent's leaders reflect the diverse people of the communities in which it serves. Selection criteria, program performance, outcome, and quality. The respondent demonstrates evidence of strong past performance against desired outcome goals and performance matrix and/or other notable accomplishments in providing services to the target population. The respondent has experience using data to inform and improve its services or its practices. The respondent has the relevant systems to process needed to collect and store key participant and performance data. The respondent has experience disaggregating program data to understand disparities. The respondent has a system or process to collect feedback about program satisfaction from participants. Selection criteria, organizational capacity. DFSS seek respondents that demonstrate qualified staff responsible for program oversight and management, has adequate systems and processes to support monitoring program expenditures and fiscal controls, has adequate human resource capacity to hire and manage staff, will have the capacity to meet the required ratio of 3 PI home visitors per 1 doula per ISBE requirements. Selection criteria, responsible cost, budget justification, and leverage of funds. DCFS seeks respondents that demonstrate the capacity the fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support total program and administration costs. The respondent demonstrates reasonable implementation costs and funding requests relevant to its financial and human resources. The proposed budget supports the proposed scope of work or work plan and demonstrates an ability to track the flow of donated goods and services. Selection criteria and its wonderful attachments. Be sure to attach reports, studies, or other documentations that show performance toward reaching the program goal, demonstrate results and accomplishments. Be sure to attach resumes of all key staff that are overseeing the program. Be sure to attach the credentials for the doula staff who will work in the program. Be sure to attach your organizational budget for this program. Please make sure all program requirements are addressed. Pre-proposal webinar, which is today, April 10th, 2025. Applications are due May 3rd, 2024. Stop, I just said it wrong year. Pre-proposal webinar, April 10th, which is today, 2024. Sorry. Applications due May 3rd, 2024. Program period begins July 1st, 2024. Budgets. State the term of the contract. State the term of the contract for the RFP. The term of contracts executed under this RFP will be from July 1st, 2024 through June 30th of 2026. Based on need, availability of funds, and contractor performance, DFSS may extend this term for up to an additional year with the extension not to exceed 1 year. The total funding for this RFP for 1 year is $952,000. The per slot cost is $4,400. Administrative cap for the program should not exceed 5%. No matches required for this program model. Please submit a budget for 1 year of services. Cost category definitions are attached as budget instructions are in every RFP. Be thoughtful and inclusive when developing your budget. Apply for your program's actual costs. We cannot give you more money than what you asked for. However, we can give you less. Use the reasonable cost question on the application to discuss how you determine the cost reflected in your budget. Common mistakes we see on budgets are fringes. Please check your calculations. Supplies. These are frequently under or over budgeted for. Client assistant. If this is an appropriate and allowable cost, don't forget to include it. Make sure your job description titles and your job description uploads have the same title. Also put a brief description of the job in the budget document itself, if you have not discussed it specifically in your application. Put your budget in the appropriate column. And I know it says show your match. Applications are due on May 3rd, 2024 at noon.
Now we're gonna break for questions. We do have a couple questions in the chat. One question is, will the award recipient be the subject to the recently passed labor peace ordinance if the program has less than 20 employees in the contract? And the second question is, will you be sending out the revised RFP? So I don't know if the program team wants to answer the first question about the.
we need to respond to that one after the webinar to make sure that we don't give the wrong information because of the less than the 20 employees on the contract. So we will respond to that so everyone has an answer regarding that question.
And regarding the revised RFP, there will be an addendum being sent out with these questions being answered. And we're about to actually go into that now. Just a couple of application tips. We suggest that all applicants start early. If you have never done business with the City of Chicago, please register into iSupplier, also known as eProcurement, ASAP. Review RFP narratives and application questions closely. Remember, they align with the scope and selection criteria. Use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuation and spaces. Each response is allotted 4,000 characters. Please do not use the back button on your browser and save your work often. Just a couple tips for working in e-procurement. You can submit your application and later amend it up until the due date, which is May 3rd at 12 noon. Avoid the rush and possible mishaps by submitting early. Plan on submission taking 30 to 60 minutes, give or take. Late applications will not be accepted. So again, submit early as possible. Submit as early as possible. And please make use of the e-procurement hotline for help at 312-744-4357. Please note that the hotline operates during business hours only, Monday through Friday, 9 to 5. Again, save often and submit early. New agency requirements. Number 1, provide articles of incorporation and any amended articles of incorporation. Number 2, IRS affirmation letter. For non-for-profit agency only. This letter must be dated within 60 days of submittal. You can obtain this by calling the IRS directly. If you are a for-profit agency, submit your original letter from the IRS showing your FEIN number. Number 3, you have to have a DUNS number. Number 4, Central Contractor Registration, CCR. Please provide a copy of the entity overview page on the www.sam.gov website. Number 5, Certificate of Good Standing letter with the state of Illinois. Technical assistance. On the DFSS webpage is a link to the RFP of interest and training documents. Please see the alerts section on the website. For questions on registration and e-procurement technical assistance for delegated agencies, you will see the email address of customer support is customersupport@cityofchicago.org, or you can also call the number listed. And for training materials, we also have the link for those as well listed. How to accept an amendment. If the RFP you are interested in has been amended, to start the application, you will need to acknowledge and accept the amendment first. Please note that the RFP shown in this and subsequent slides is just an example. To accept the amendment, click on the View Amendment History listed in the upper left-hand corner. If the RFP has not been amended yet, select Create Quote from the drop-down menu in the Actions box and click on Go. This will take you to the application page where you can get started. How to accept an amendment, step 2. To begin the acceptance and acknowledgement process to open the RFP in view only, number 1, click on the document number. Number 2, to review the amendment changes to the RFP, click on the infinity or eyeglass icon. To acknowledge receipt and understanding of the changes and proceed, click on Acknowledge Amendments button. By acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. How to accept an amendment, step 3. When you get to this screen, click on the I accept box and then click on Acknowledge. Click on Yes to indicate you confirm your acknowledgement of the amendment. Finally, one click on the checkbox that you accept the terms and conditions. And then click Accept to actually accept them. This is the final step in acknowledging and accepting the amendment. Now, how to submit an application. When you are ready to submit, start by saving your draft one last time, then click Continue. If you are missing any information, you will be given an error message at the top of the page. It's usually on the top left-hand corner. Usually the error messages direct you to something left undone in the application. In the last example, the error message indicated that the lines had not been filled out. So the system will let you know if you left something undone. In this example, the error is about an unanswered question in the application or the requirements section. The quote values refers to your, in this case, missing the answer. Once your application is free from errors, you are ready to proceed and submit. At this point, clicking Continue should put your application into the review and submit phase. This is your last chance to review all your data and confirm that it is accurate. Check your attachments and scroll down to the bottom of the screen to see all of your responses. This is how the screen will look. At the bottom of the screen, you will be asked to provide an electronic signature. Be sure to fill in the signature box before checking the box. Then the last step is to submit. It's in the lower right-hand corner of the page. Please make sure that you see the submittal confirmation on the screen. The e-procurement system will send a confirmation email within 24 hours of your submission. Please call or email if you desire confirmation prior to then. Now we're going to open up the floor for any more questions. If you have any questions, please contact Angel Jones Dodson. Contact information is listed here. And for any non-programmatic questions, please contact the e-procurement hotline number and email address is listed here. And that concludes the RFP webinar.
There is one more question in the question box.
Okay, question. Are our original submission for the FY25 RFP still in iSupplier? Are we able to simply resubmit if everything is already in the system, or do we need to enter everything again?
Jessica, you will need to enter everything again. iSupplier does not save RFP responses. Once the close date goes, those things are no longer accessible. So you will need to go in and type your full application again.
Any other questions before we close out? All right, that concludes our Doula Specialized Services RFP webinar. Everyone have a good day.